might want better, see-through blue. Yeah, we're actually ready to go. Let's go.
Okay. All right, welcome to the Chophouse, Beef Bootlegger Chophouse. We're at Meatstock 2026. What brings you here?
Meatstock. This is one of the ways I recommend people control their type 2 diabetes. You do it with diet.
Absolutely. So you're a doctor. Are you an expert in controlling type 2 diabetes?
I like to think that I am. That I started my adult life as an as a pharmacist, and decided I wanted to go to medical school. So I went to medical school, and after medical school, I did a residency in ophthalmology at the Cleveland Clinic, and I've done that for about the past nearly 30 years. And the past 5 or 6 years, I noticed that chronic diseases are really taking off, and I felt we don't manage it very well. And it turns out I'm right. We don't manage chronic diseases well. Modern medicine has this wonderful halo around it because of the things we do for acute diseases. We can fix broken bones, we can treat pneumonia, we can stitch up wounds. But when it comes to the chronic diseases, we're actually quite terrible, but people don't realize that they get locked into this model where they have chronic diseases that require medication after medication after medication, and they continue to decline. And I thought there's got to be a better way, and it's been a journey discovering that way.
So let's talk about the conventional way that they were treating that disease up until modern times, and what are we doing nowadays, or what do you prescribe?
Well, conventional wisdom would say type 2 diabetes, it's a chronic disease, you can't cure it, you can only control it, and that has to be done with medications. They give lip service to lifestyle modification, but they really don't put much effort into it. Mm-hmm. Just most patients end up on 1 medication, 2 medication, 3 medication, but they're not truly getting better because we're not treating the underlying problem.
Right. So what do you think meat is doing for a type 2 diabetic if they move over to the carnivore diet? What might improve, how quickly, and so on?
Well, what I recommend if they were doing straight carnivore, these people are their simple carbohydrate intake, even their complex carbohydrate content, goes essentially to 0. And that's one of the main drivers. There are a lot of drivers of type 2 diabetes. The number one in my mind is our diet, what we eat. Mm-hmm. There are other factors like inactivity can also drive it, lack of sleep, which Americans, we're poor sleepers as a country, and just poorly regulated stress. We just don't manage stress well either. But diet is the number one driver. I think if you fix the other problems, but you don't fix the diet, you're not going to fix the diabetes. If you fix the diet, sometimes that's enough, and you don't even have to completely fix it, but you do have to improve it. It has to be something sustainable. So some people can sustain carnivore long term, and that's fantastic. Some of my patients can't, and they may supplement and be more like a ketovore, which I'm okay with that too. I have this finish line. The finish line is health. I want these people to be healthy, and whatever path they take to that destination is fine with me. Carnivore is an excellent path. I think ketovore is fine too. Just a regular ketogenic diet can work as well. Vegans can do it, but boy, that is a real challenge, and I'm not an expert at that, but it can be done. But there are some modifications like vitamin B12. They can have problems with that and may need to supplement.
Interesting. If we just stick with the carnivore and keto war, how quickly do you see some of your patients getting off medication once they change their diet? How quickly might they see an improvement enough to get off of the meds?
Some of them within 2 weeks,
wow,
they're off of medication. I have a patient who was on insulin for 10 years. Now, it took a few months to get him off of it, but once you get them off the carbohydrates, their insulin sensitivity starts improving fairly quickly, but some of the more insulin resistant people, it can take a few months
Still months, it'd be pretty dramatic though, right? Versus a decade.
Absolutely.
How many patients have you helped?
Boy, that's difficult to say.
Or directly, right? Directly and indirectly.
You would like to say hundreds, if not thousands, but the ones that really stand out, there are handfuls that really stand out that make dramatic improvements.
That's good for you. So every person, though, is a life that you're helping, maybe even a life that you're saving.
Many of these people turn into evangelists that...
Well, there you go. That's the exponential effect right there.
People out in the community that are spreading the word, and people are saying, but that's not possible. You can't cure type 2 diabetes. And we say, yes, you can. And the argument against curing it is, well, they can get again, they relapse.
Relapse, yeah.
But I relate it to, if you go skiing and you break your leg, okay, we put it in a cast. Months later, that bone is healed. If you go skiing again, you may break it again.
Right.
You broke it again. We don't say, oh, well, it relapsed, your broken bone came back. No, you broke it again.
That's a great point.
So the pathway that got you to type 2 diabetes, if you go down that road again, you're going to become a diabetic again.
Do the same thing, expect the same results.
Right, exactly.
Okay, so what percentage of doctors do you think are out there prescribing a diet change versus medicine? I mean, is it getting more prevalent? Obviously, every year it's probably getting a little bit more, but how prevalent is it?
My suspicion is it's probably 5% or less. It's very low, disappointingly low.
Yeah. Well, it's probably less profitable, right? So that matters. How about the type of meat that they're eating? Do you want to eat fattier meat? Meat is a broad topic, right? So are there any type of fat recommendations or whatever for the intake?
What I recommend is what they like. I like ribeye. That's my favorite meat. It's a rather fatty meat.
Yeah.
I think that's perfectly fine. If people like a leaner meat, that's okay too. Whatever they find that is sustainable for them, I'm okay with. Not fried chicken, not fried fish. Chicken is okay, fish is okay, but once you wrap it in that breading, that batter, it's basically just a donut stuffed with chicken or a donut stuffed with fish. So whatever the patient can sustainably eat.
How about oils and those type of things? Do they have to stay away from any particular type of oils?
I generally recommend what I personally use, and I use avocado, I use olive oil, I use ghee, clarified butter, I use butter, coconut oil. I tend to stick with those.
Staying away from the seed oils, basically. Everything else. I
generally say stay away from the linoleic acid, and I'm not an expert in that, but my understanding is those can be peroxidized into toxic inflammatory products, and until we have a 100% definitive answer, why not just avoid it, because we have some wonderful fats.
Fantastic. What about vegetables or anything like that? Do the vegetables matter?
Vegetables, I recommend stay away from the starchy vegetables. And generally what I tell them, if it's a vegetable, you're eating the part that grows beneath the ground, avoid those. So that's your potatoes, your baked potatoes, carrots, radishes, turnips, rutabaga, beets. What have I left out?
But that's a good rule. Anything that's growing under the ground, stay away from.
And when it comes to, that's what I recommend they avoid. What I recommend they eat: broccoli, cauliflower, asparagus, Brussels sprouts, cabbage, lettuce, kale, spinach, and collard greens.
What's in those that they're benefiting from?
Well, I think the big thing is what's not in there. There's not a lot of carbohydrates in there.
Okay.
So there are a lot of nutrients in there, but I want them to focus initially on eliminating
the carbs.
The carbs that are going to drive their blood sugar up, which is going to drive their insulin up, which is going to drive their insulin resistance. So they just don't respond well to insulin anymore, and we want to improve that. And improve that by decreasing their exposure to carbohydrates.
There we go. I love that. Maybe just someone who's curious, right? They're watching this and they're thinking they want to learn a little bit more about it. Do you have any guidance on where someone might go to just get some preliminary education?
Someone who enlightened me was Ben Bickman.
Okay.
The guy is amazing, that I've taken part in some programs that he's had online, and it has really expanded my horizon. There were things that I was always curious about. He explained those things to me, and it was mind-boggling. He would always say, I'm a scientist, you're the clinician. You have to make decisions. I can tell you how the body works, but you've got to figure out how to put this into clinical practice.
And is he a professor, or
Yes.
what's his background? Okay.
He is a professor of cell biology at Brigham Young University. I think he considers that cell biology.
Yeah.
I know his PhD was in bioenergetics.
And has he been around a while?
Well, not as long as I've been around. He's younger than me, but yeah, he's been around for a while.
Very good. Are there any other names that people might want to check out?
He's the main one that I think that he's just brilliant. But there is another professor, Paul Reynolds, at Brigham Young University, kind of a colleague of Ben Bickman's, who talks about glycation and inflammation. And he has a wonderful YouTube channel that I'd like to see grow.
There we go. What's that YouTube channel? Do you know?
I think whenever I'm looking for it, I just put in Paul Reynolds, PhD, and
There we go, and it shows up. God bless
he
YouTube.
calls it College of Glycation.
Okay, sweet. And what about if someone wanted to find you? Where can we find you?
I usually just hang out on X.
Okay.
And I'm at Gregory Mays MD.
All right. Well, Greg, thanks for coming.
All right. Thanks for having me.
Beautiful. Sweet.
Yep.
All right, Greg, that was good.